Hi, I'm Dr. Scout. I'm from LGBT Health Link, and each week we bring you the top LGBT health news and wellness stories in 3 minutes or less. So let's get right to it. Let's find out what the stories are for the week of November 21st, 2014. We are really excited about our first story because it comes from us. We partnered with Promo Missouri and lawyer Corey Prakniak and 70 other LGBT and allied organizations this week to release the first ever LGBT healthcare Bill of Rights. So read Mr. Prakniak's great blog about it on Huffington Post Gay Voices, and also download your copy of the actual Bill of Rights from the website, put it in your pocket, and be ready to stand up against discrimination in healthcare wherever you go. Next story, there's been a few different developments to help hold providers to a higher standard. The American Association of Medical Colleges just released a report on the educational standards for medical schools on LGBTI health issues, about time. And the University of Louisville School of Medicine is testing a national program on training physicians in health. That sounds like it could be amazing. The importance of these new developments is only highlighted by 3 new research studies outlining specific health disparities among all bisexuals, bisexual men, and transgender people. So again, it can't come soon enough. Next up, right as we celebrate this week's Great American Smokeout, the University of North Carolina researchers published a review of LGBT smoking cessation programs. After the review, the researchers recommended that more community organizations adopt and promote smoke-free policies and provide linkages with cessation services. It would help us get over some of our barriers to care. Also, a New Jersey health plan begins a new tobacco harm reduction program, and interestingly, they cited LGBT tobacco disparities as one of the reasons for the project. Love it. And next we hear that only 13% of young gay men are getting HPV vaccine. This week, at the same time, President Obama was presenting scientific awards to 2 scientists for their work on developing HPV vaccines. New studies are reporting that about only 13% of young gay men are getting these vaccines. But they also find that if your doctor recommends it, most gay men do it. So they're encouraging more providers to recommend vaccination for their gay male patients. Our next story, bullying and LGBT youth health. We were really proud of the American Public Health Association for just making an official statement about the negative mental health effects and other results of LGBT bullying. They suggested more research and programs that promote LGBT youth safety. We agree. And our last story, gay blood ban from forever to last year. A 31-year-old ban on gay and bisexual men ever donating blood was reviewed by a federal panel who suggested partially lifting the ban. Potential donors must now not have had sex with a man for a year prior to the blood donation in order to be accepted. A Huffington Post blogger still objects, asking for the FDA to stop discrimination amongst gay men and blood donations altogether. That's it. That's your top news for this week. We encourage you once again, visit www.healthcarebillofrights.org to download your own personal wallet-sized copy of the Healthcare Bill of Rights. Put it in your pocket and make sure you're standing up for LGBT equality in healthcare every time you go to a doctor.